Hello, and thank you for joining us today for our webinar on how to optimize your supply chain to drive superior patient experiences and clinician and supplier efficiencies. Before we get started, I have a few items to go over. This webinar is being recorded, and in the next 1 to 2 business days, we'll send out an email with you with a link for where you can access the recording. During the webinar, all attendees will be in listen-only mode throughout the presentations. If you have a question or a comment, please enter it in the chat box, which we will be actively monitoring. We will plan to answer all questions during the Q&A portion of the webinar. However, if during the demo that Kaushik will be doing, you have a specific question that's relevant specifically to what he's going over at that time, can address that question live so that Kaushik has everything up in front. I'd like to introduce our two speakers for the day, John Bowdler, who is our Vice President of Professional Services at Mesa Global, and Kaushik Ramakrishna, who is our Practice Director of ERP here at Mesa Global. And just want to give you a quick overview of what our agenda looks like today. So we just went through the welcome and introductions. John's going to talk to us about the importance of supply chain to healthcare organizations. And then Kaushik's going to give us a really great deep dive demo into the Mesa Care Supply solution. And that's also going to cover materials management, e-procurement, and vaccine management solutions and processes for best practices, and we'll close out with our Q&A at the end. We initially scheduled the webinar to be from 12 p.m. to 1 p.m. Eastern Time. We expect, though, that it should go to about 12:45, 12:50, so we'll be able to give you a little bit of time back in your day and appreciate you spending your time with us today. So with that, I'm going to get it started and kick it on over to John. John, the deck is all yours.
Thank you very much, Sue, and thank you. I appreciate the opportunity to speak with everyone today, and I welcome you to our presentation. Today, along with my teammate Kaushik, as Sue indicated, would like to give everyone what we're doing today with supply chain management, particularly in the healthcare vertical. But first, I would like to start by giving a little background on Mesa Global as an organization itself. So if we go to the next slide, please. Okay. We have been in the Microsoft ecosystem for over 18 years now, and we were founded by three gentlemen who worked deeply in the development arm of Microsoft many years prior. One thing that we are most proud is being part of the Microsoft President's Club, or Inner Circle, for the past 3 years, which is typically reserved for the top 2 or 3% of all Microsoft partners. So yes, we are very proud of that designation. We do have a global presence with clients and team members in several different countries outside of North America. And as indicated by our year-over-year growth there, we are growing rapidly and will continue to do so. Okay, next slide, please. You know, what is most important, however, is really the depth of experience we have in the healthcare industry itself, and the stories of success we have with our client base. You know, take for example Adventist Health there in the lower right-hand corner. You know, what originally started out as a vaccination solution for their 40,000 employees that has really expanded, and we are really now looking to expand well beyond that, with a platform to track all of their employees' health and wellness throughout the entirety of the pandemic, and providing them any support mechanisms they need to help shepherd them through this pandemic as we go forward. Gonzaga University was as many universities, concerned about their students returning to campus amidst the pandemic. We originally implemented our back to school solution to ensure students and faculty, the symptoms they have or the lack thereof, we were tracking those daily to limit the possible exposure and virus spread. That solution then has been expanded to include system checking of guest registry to the campus with contractors and guests, and eventually the vaccination management of all students, which is integrated with their faculty and student health centers. Let's go to the next slide and talk a little bit about the importance of the platform itself and how we are able to leverage its capabilities. Okay, you know, I've been in the Microsoft channel for over 18 years myself, and I've witnessed the evolution of the platform firsthand. I do have to say, in those early years, I never envisioned the power to which it has evolved to today. It is developed into a very highly flexible platform that allows us to rapidly build and deploy solutions into the marketplace to respond to need. So what we have done is we have taken the core platform of which you see here, and we've expanded upon it with our own MazikCare IP, which is really illustrated on our next slide here. Okay, and so what we have represented here on the slide is we've taken the normal Dynamics Power Apps business intelligence. Go back one, I'm sorry. There we go. We have taken the normal Dynamics Power Apps business intelligence and layer on top of that our experience and know-how in the healthcare and supply chain management. And it's created a very powerful solution that we're able to help drive and deliver our clients to success. Okay, so if we go to the next slide real quick, please. We'll talk a little bit more about our healthcare experience and the depth in which it's constructed in our overall solution. You know, during the evolution of the Power Platform that I mentioned earlier, you know, we've taken our industry know-how over the last 7 years, and we've developed what we call MazikCare. And this slide illustrates the depth we bring to the market with our MazikCare solution that encompasses supply chain management and many other modules and components designed to address a variety of business needs within the healthcare industry. Okay, I'm now going to call on my teammate Kaushik to speak toward a couple of clients we have worked with specifically with supply chain management and healthcare, as well as provide a demonstration of the functionality overall. Okay, so I'm going to kick it over to you, Kaushik.
Sounds good. Hello, everybody. Thank you for joining. Good morning, good afternoon, wherever you are. Nice to have you. So on screen you have DuPage Medical Group, one of our largest customers here in the Midwest, that recently went live on our supply chain solution. So DuPage is a physician-owned business, and it's about 700 clinics here just in the Midwest area, right, and around the Chicago area. And they had this need of bringing accounts payable, financials, procurement, everything on one single platform. But they also wanted to make sure they have 700 clinics, and they did not want a long training process or a cycle to help get their people accustomed to use the product. So here we built an Amazon-style experience for the front end so that they could order supplies easily without having to go through multiple screens or multiple steps, and kept all the business logic and financials intact at the same time, so they could get some real-time GL and spend reporting. So that's DuPage Medical Group. They went live on accounts payable, expenses, GL, procurement, and we have been expanding. So we are expanding to point of sale systems, retail. So the product itself, the framework, offers a lot of capabilities, and we are expanding. So that's DuPage Medical Group. So next slide. Sure. We have Midwest Vision Partners, which is again, a physician chain and optical specialization here in the Midwest. So they had a need to go live on an ERP application within 10 to 12 weeks, and we were competing against NetSuite and other products. So we actually took on that project knowing it was a tough time frame and it's going to be complicated, and we actually got them live in 10 weeks. It was planned for 12 weeks, but we actually got them live in 10 weeks on accounts payable, GL, procurement, and expenses. And it was a really rapid deployment because we reduced a lot of training effort, reused a lot of templates, and that we got them to the speed of implementation, and the customer was really happy about the whole project. Okay, so next one. So the real objective of supply chain is how do I allow nurses and the front office staff to do what they do best, which is take care of patients, and also be able to order supplies to keep keep the clinic running and to give the patients what they need on time, and actually not spending a lot of time on the system, and rather spending it on their actual job, and how we can help them do their job better, right? And how we can also control the spend, inventory levels, inventory accuracies, give them what they need on time. With the pandemic, it is so important to get the immunizations in the right place, the vaccinations in the right place, oxygen tanks. There's so much to supply chain that could help enrich the human experience. Okay, so next slide.
Yeah, I'm going to turn it over now for you for your demo. So I'm going to give you some presenter options here. And you should see a screen pop up for you to take control. Yep.
Sure.
All right, we see your screen loud and clear.
Okay, so this is the homepage experience of what we have built for some of our customers. In the healthcare, but it could be widely used in other applications as well. So this is what we call our Amazon style or e-procurement experience, where people can quickly go in and order products, receive purchase orders, save some wish list, add their favorites, and they can also approve the request that is assigned to them. So this is a complete homepage experience. They don't have to navigate to 10 different places. They can do it all in one place. So just to walk you through some of the scenarios. So if I want to buy some, catalog items. So let's say I want some stickers from Smile Makers. I can quickly go in here, search all the stickers I have in stock. I can filter by availability, by price range. If there is multiple suppliers, I can filter that. I can also quickly change the unit of measure, quantities that I need, and add items to the cart, and start building up my cart. Within the same product range, I can also go search for products that Sanofi supplies. If I want to buy some immunizations, and I can quickly look at all the Sanofi items. You see the vaccines here, so I can add it to my cart. So there can be scenarios where there are items not available in the cart and they're not a punch out, but these are one-time purchases that I want to do. I can quickly do a non-catalog purchase and add items to my cart as well. So if I want to buy some lab coats, from, let's say, RPS Imaging, the vendor, and for Dr. Smith, I can put in the unit of measure, the quantity I want to buy, and the price if I know the range, and I can quickly start building my cart, right? Another way of buying is I can simply do a punch out. I don't have to store items in my catalog. I can connect to an external vendor, go through their website, and quickly start building up my cart from their website. So I think we have CDW connected, so I can quickly go through the CDW website. From here, I can search their products and add them back to my cart. Okay, that should bring the item back to my cart. Okay, so there I have my cart built up. So I can add catalog items, I can add non-catalog items, punch out to an external website. Everything is a single and simplified interface, right? And you will also notice that I can choose a delivery location. It defaults to my delivery location, but if I'm ordering for multiple locations, I can pick and choose my location. And you will also notice that the financial dimensions for my GL expenses spend analysis is automatically tied to my location and to my user. So system is automatically recording the spend and against the budget. So the user will have a seamless experience, but we are also catering to the financial needs in the background. If I'm actually buying it for COVID related expenses or an acquisition or a build out, I can actually tie all that to the purchase, so I can also track my spend against a project. So from here, I can either choose to buy this request, or I can actually save for later, come back and add more items and buy it. So that's another experience we have. So once I hit on buy now, it actually drives certain rules and create what we call as requisitions in the background. So I can go to my home screen and I can actually look at the different tiles. I have the request prepared by me. I have, if it's anything pending my manager's approval. If I want to look at the approved request, or if I actually want to track down the purchases, I can look at that. So if I look at the request prepared by me, it has all the requests that I have placed for my location or placed by me, and the different types. So you will notice that there is consumption and replenishment. What it really means is some items can actually come from the vendor, and some are coming from my central supply location, right? So system automatically knows that based on the rules we have set up against the catalog, and automatically places an order against central supply. So we have we have automated some functions there. So from here, I can also track who it is assigned to. Now, this basically runs a workflow engine in the background. So I just wanted to give you a quick view of the workflow engine. You can set up, these rules are configurable, and it's a graphical experience. So you can set up all the workflow rules, and you can set up the hierarchies and the spend limits, and actually trigger the workflow based on the position in the managerial hierarchy. Or you could have other rules defined in the system. So it's pretty configurable, flexible, and assigns the workflow based on those rules. So if I actually navigate back to my home screen, if I have any requests assigned to me, so for example, if I'm the manager and if I'm getting requests from my team, I can always go in here and review the request. I can see what was the request for. It was for lab coat. So right now, since I'm a super user, I'm just assigning it to myself so I can demo it. So you will see the request assigned to me. You can see what is the amount over budget. You can approve the request from here, reject individual lines, or also delegate it to somebody else. So that is the whole requisition approval process. And once the request is approved, there is a whole backend application that has a purchasing and vendor management. So you can release purchase orders to vendors, send emails, send confirmation, send revisions, track purchase order cancellation. So that whole 365 in the background. So from here, I can also track my purchases. So being a requester, I don't have to call my purchasing team and say, hey, where's my order, right? I can always go in here, track my request number sorted by date, or filter by date. I can see what is the status if it's assigned to somebody, if it's approved and closed, if there is a purchase order number or a transfer order number that's related to the central supply, I can see it here as well. So we have all the details and reporting built on one single screen. And I can also see how much is shipped, how much is remaining, and if it's a purchase order, I will get the information here as well. Hey, so if I'm going too fast or if there's any questions, please let me know. I can take a pause.
Yep. Did have one question where you're looking at the different vendors that you're working with, is there an experience that the system provides where you can try to roll up or leverage or see other, like that Amazon experience that you had referenced, see other vendors that might have similar products to maybe view and say, hey, maybe I want to try a different vendor, or I have so much money that I'm spending with this vendor. Is there a way I can get some better efficiencies in a negotiation discussion with them?
We do have a lot of reporting that's not in the shopping cart, but we do have a lot of reporting to do the spend analysis and contract negotiations with the vendor.
Okay, excellent.
Okay. And within the same screen, down at the bottom here, so when you receive packages or items or supplies from your supplier, you can actually go to the home page, same screen here, scan the PO number, search for the PO number, and click on receive now. And it's gonna let you receive it and post it from here, right? So this automatically does the purchase order accrual, the financial posting in the background, and everything is taken care of. And we also do three-way matches based on this. So if you're getting an AP invoice, it matches up against the receipt and automatically does a three-way match for you. Of course, you saw the favorite items, and we spoke about the save for later function. So basically, if you want to mark something as a wish list and come back and work on it later, we have that option as well. And you can just quickly move it from move it to cart from here. You can also see what are the items that's available, and move it to cart and work from there. Okay. I can also see any rejections. So if my requests are getting declined or rejected, I can also see that from within the home page, and I can also get email notifications. So if anything is rejected, I can see it here and see the reason why it is rejected, if there is a reason provided. Obviously, this was a very high dollar. I rejected that. So okay. So that's the seamless buying experience that we have, and take it down to receiving AP payments and invoicing. It's all connected. So we also have added some capabilities for part management. So basically, you can set up a location as a par location, very standard par functionality, right? So you can set up an item as par location, location as par location, add items to the par location, and set up the max par levels against that. And we also have functions to perform automated replenishments and revisit the par levels on a frequent basis based on the usage history. So you can set up those par locations and the par level counts, and basically run a par request. So system can automatically generate this par request based on the frequency that we have set up, or the user can actually go in and create a par request and start performing the count as well. And it's all restricted, security controlled by the user that has access to the location. So from here on a par request, I can actually enter what is the counted quantity, which is obviously my visual count. And notice that the system will automatically calculate the quantity to replenish based on the max par level, and it also captures who was the person who performed the count. Right, so I can say 99, and system performs the count. And when I actually hit submit par here, it goes back to my shopping cart experience. So it add the item back to the cart, and then goes through the same submission and requisitioning process. Now, usually requisition comes from central supply, but obviously we have flexibility to do central supply and purchase orders. We also have an application, a phone application, to scan in the par count. So just like you entered the par count here, we can also go in to the par request through the phone app. This could also be tablet, by the way, and this is all built on the low-code, no-code platform for Power Apps from Microsoft. So that's what we leverage. So you could go in here, scan the NDC code or scan the item and start entering a par count. So exactly same experience. You can enter the par count or scan in. If it's on the barcode, we can get that information as well, right? So that is a par count. So when you submit, it actually goes in and creates the shopping cart. Now, added capabilities for central supply. Once the purchase orders are generated and transfer orders are created, the central supply will actually have to manage, the receiving of purchase orders, shipping of transfer orders, and then the receiving also has to happen, right? For if they have transfers coming in. So we have a very app built on a very similar UI experience for central supply. Simplified version of the app to be able to receive purchase orders. They can quickly go in here, see all the purchase orders that they have incoming, and they can quickly hit on enter, scan in the PO number, and should be able to scan the NDC code and receive the items. And it shows how much is remaining. We also support batch numbers and expiration date. We have another version of the app. Some customers don't want to track batch numbers, so we keep two versions of the app just to be able to support that. And we also have a tablet experience for the app. So receive the quantity, very similar experience. If they want to be able to ship the transfer orders to the various part locations or clinical locations, they can quickly go in here, scan the transfer order number document that they're getting or the request that they're getting, and exactly same UI for scanning the transfer order number. So this one is vaccination, and then they can scan and see how much quantity that they need. And we can have multiple unit of measure set up as well. Okay, that's the whole app experience. Now I do want to show some of the dashboarding capabilities that we have built around the vaccination itself and around the inventory management pieces. So you will notice that this app is actually being leveraged for purchasing, for departmental requests, for par counting, for vaccine management. It's kind of built to be able to fit the needs of everybody. So we have dashboards that show what is my on-hand availability by items, by locations, by various locations that I have. I can also do additional filters if I just want to look at immunizations or any other items that right here. So I can filter down. I can also filter on a particular item. If I want to look at the stock of just say one of the immunizations from Sanofi, I can look at that. If I want to look at the stock of stickers, I can change that. You could also filter by a particular location if you just want to look at one location. So somebody sitting at the purchasing or at the central supply knows exactly what's going on in real time, right? So they don't have to go to multiple screens to pull the reports or email 10 different people to get that information. So I can also run some inventory statement charts. So for example, if I want to just search Pfizer Covax. So I want to see how much the vaccine is being used by location, so I can quickly see how much is being used. The usage is based on patient consumption, obviously, and the wastage, right? If they record any wastage, I can track that wastage information as well. And you will see what is the month-on-month statement summary or the stock statement summary for the vaccine by month. We have also added the lot raising capabilities for recalls. For example, if I wanna look for a particular lot, say I want to look at this one. I want to see how much I have available in stock, right? And what was the actual purchase order that it came in through, and if there is any usage, right? We don't track the patient information, but we connect it to our vaccine flow application, which has the patient information. We just don't want to, we just want to keep it HIPAA compliant and not bring any of the data here. So we just track the usage by date and be able to, match this to what we have in our vaccine administering and get that information. We also have a batch expiration report. Kind of shows what are the batches that is expiring. Maybe it's taking time to load, so I will skip that one. And we have an inventory audit dashboard. This one was kind of strongly built to avoid wastage or see how much is out in ambient temperature and refrigerated conditions. So kind of we have rules, storage types, conditions based on each transaction type, whether it's being consumed against a patient or whether it's being received at a central supply. So we had certain rules built, and we showed the stock availability on various storage types. I think Sue, I think I'm covered on most of the functionality portions, and I can hand this back to you.
Okay, perfect. Thank you so much, Kaushik. Much appreciated. All righty.
Thank you so much, everybody.
Let me share my screen here. So we're going to get into our questions and answers part right now. Let me just get my screen back up here. Oh, let me change presenter back to me. All right, show my screen. And let me start the slideshow. All righty, so have a couple of questions to enter into our Q&A portion here. So Kaushik, some might be relevant for you, John, some for you. Just you gentlemen could jump on in. So one of the questions that came in advance of the webinar starting was about security. What type of security is in place as far as what the solution is built on? Is it protected both from the Mazik Care IP platform? What is it living on the Microsoft side? And how does all that security work?
Sure, I'll take that one. Yeah, so this is purely built on Microsoft Power Apps platform and F&O platform and deployed on a customer tenant, right? So the data security, everything is within the Azure database, which the customer owns, and only the customer has access to it, and they can we only get guest access. So we don't have any of the data, or we don't store any of the data. And from within an organization perspective, there is also roles and responsibilities that come out of the box within the application, and we also have added some of the roles and responsibilities, which will restrict the data that each person can see, and the in terms of the amount of data and the various screens that they can see. I hope that answered the question.
Okay. And then what is on the customer side of things as the solution's being rolled out? Is there any limit, or should there be any limit, or how does Mazik Global work with creating what the best practices look like, especially around touch points for approval processes? Should there be thresholds or in dollars? Should it be a certain number of people? Is that customizable? What does it look like out the box as far as when someone adds something to a shopping cart? Who has the authority to actually hit that submit button to spend that money, and what does that process look like a little bit more deeply?
Mm-hmm. I did go through setting up the workflow rules and the workflow conditions, so it's pretty configurable. You can set it up based on the compensation levels, the spending limits, and also have a managerial hierarchy set up based on the spending limits and approval limits. So that is all pretty configurable in the system.
And John, I just unmuted you. Sorry about that.
That's okay. Thank you. Kaushik did a great job fielding those. So.
Perfect. And you had mentioned about the Midwest Vision Partners and the acceleration of their release. obviously not a fully standard release that most folks would have. For someone or a company that's trying to gain some efficiency as a healthcare provider, what would this look like as far as if they're trying to build out a schedule? Is this something that takes 1 quarter to put in, 2 quarters to put in? Once it's in, how soon till they start realizing those efficiencies? Kind of a specific question, but are there any generalities around that?
Of course. So we do when we start a project, based on our previous experience, based on the solution that we have built, we do come up with a standard set of predefined business processes that we offer as part of the scope, and we do come up with the standard data templates and configurations that are predefined in the system, and it all depends on the customer readiness. We promise a 12-week rollout, and we have done it multiple times in the past. If we have the data in place, then the training effort, it's quickly up and running. So you go project day one, sample out the data templates, get that information, and start training the users. That's kind of the approach we take, and we have done it for almost 3 to 4 customers now, and we have done 12 to 14 weeks rollout. And there are customers that need more time figuring out the data and do the training, so that's a little bit longer. So it purely depends on the customer.
Yeah, and that really kind of harks back to at our experience in the healthcare industry with those predefined business processes that Kaushik mentioned. By bringing those to the table early on helps with the velocity in which we can implement the solution and bring to value as quickly as possible.
Okay, perfect. All right. Well, those were the questions that had come in advance, and I don't see any questions from the attendees. So we are at 12:40, so a little bit faster than we had expected, but still some really, really great content. Loved seeing the visuals. Really like the features of the Amazon cart experience. So with that, unless there's any other questions or any last minute thoughts that we want to add, we will then wrap this up and plan to send out the recording to all of the attendees and everybody who had registered for the event in advance so that they can leverage this great knowledge. So with that, then I'm going to end the broadcast. And John and Kaushik, very much appreciate your time today and your expertise in sharing about e-procurement, the care supply solution, and how organizations can really gain some efficiencies, especially in the healthcare market.
Yes, thank you very much, Sue, for facilitating, and thanks everyone for attending.
All right. Everybody have a great day. Thank you.